Betty Murray, Certified Nutritionist and Education Director for the Greater Dallas Gluten Intolerance Group. And today I want to talk a little bit about gluten intolerance and celiac disease and what symptoms you might be having to either one of those conditions. So what's interesting is celiac disease and even gluten intolerance or gluten enteropathy have a wide variety of symptoms. And actually even celiac disease people who have a positive endoscope biopsy for celiac disease, almost half have no digestive symptoms. So what's interesting is the first symptom would be gas, bloating, and diarrhea, usually chronic diarrhea. And if it's on a severe level, you may have malabsorption, malnutrition, and even failure to thrive, particularly in a small child where the nutrients aren't getting to the body because of the destruction in the small intestine. So definitely chronic diarrhea is often a first-line symptom of celiac disease. So what's interesting is what we're finding looking at all of the studies, particularly looking at celiac, because most of the studies are done on celiac patients, because once you have that diagnosis, it's easy to determine by doing an endoscope that the symptoms can be quite different. We do know, looking at research today, that IBS in itself often it plays a hand in gluten intolerance and celiac, that what gets diagnosed as IBS often is ameliorated or improved by going gluten-free. So even in IBS, it could be somebody who vacillates from diarrhea to constipation, or may just have chronic gas, bloating, intestinal pain, even heartburn, even throat clearing, even stomach cramping or gallbladder issues. The majority of people that have celiac disease, a lot of them have had their gallbladder removed. And part of that is the destruction on the intestines actually affects the appropriate signaling back to the gallbladder to squeeze out bile to help emulsify fats when you're eating. So even gallbladder issues often tie hand in hand. So what if you don't have intestinal symptoms? Could it be something else? Well, what we do know from the leaky gut activities and the irritation and the destruction of the intestinal lining and also the autoimmunity activity to those tissues is that that same activity can happen other places in the body. So you can also have reactivity in the brain. And what we have seen in a lot of studies that have been actually posted in like Time Magazine and Nature Magazine and several of the medical journals, New England Journal of Medicine and Lancet, is that what looks like behavioral neurological issues is similar in a celiac patient as it would be in maybe, let's say, a child that's been diagnosed with ADD or ADHD. So what we do know now is, particularly in behavioral neurological issues, is there's a blood-brain barrier that wraps the brain. And it was thought that that blood-brain barrier was not permeable, that things couldn't get through it. But what we now know is that it can be highly permeable and actually damaged, either from autoimmunity or other issues. And that lots of things can cross that barrier and affect the brain. So particularly in celiac disease, PET scans of celiac patients compared to ADHD children show the same sort of brain PET scan firing. So what that means is that the activities and the behavioral things that look like ADHD may also be true of a child that's just suffering from celiac disease. The same parts of the brain fire up, and that there's an inflammation or a fire in the brain that can occur based on that immune reactivity. They have done studies in Europe, actually in England, with schizophrenics who had schizophrenia that was not improved by drug therapy. They took a subset of that group and put some on a gluten-free diet and some on a regular diet. Of the ones that went gluten-free in this particular study, 50% of that small group saw a reduction and a complete reduction in schizophrenic events during the gluten-free diet. So we're starting to see that that neurological behavioral component is actually at play in the brain in celiac disease and also gluten intolerance, either with or without any digestive symptoms whatsoever. So celiac disease patients, almost 50% that are diagnosed, biopsy diagnosed, do not have any digestive symptoms. So they could have other things, joint pain, swelling, other autoimmune conditions, fibromyalgia, skin conditions, eczema, psoriasis, definitely dermatitis herpetiformis, lots of other symptoms. So what's interesting is when you start looking at the myriad of symptoms you could be experiencing and whether it could be related to what you're eating, there's a possibility. There's definitely a possibility. So one of the things you can do if you're not sure is just remove gluten for a period of time. I recommend no less than 3 to 4 weeks. Actually 6 to 8 weeks is best at a minimum to allow the immune system to calm down to see if you see your symptoms change, because it may take that long for the immune system to ratchet down and the symptoms could be varied. And so from that standpoint, you can have lots of different symptoms. So if you're not sure, I highly recommend checking out a functional medicine physician or even a functional nutritionist that can help you navigate just the removal of the foods and to figure out and keep a journal of what's happening, or at least doing maybe food sensitivity testing as a start to see what's really happening. I thank you very much. I hope you guys have a healthy and happy day.